Pre-Hospital Emergency Care Council, PHECC, is the regulator for emergency medical services in Ireland. PHECC is an independent statutory agency with responsibility for standards, education and training in the field of pre-hospital emergency care. The Pre-Hospital Emergency Care Council protects the public by independently specifying, reviewing, maintaining and monitoring standards of excellence for the delivery of quality pre-hospital emergency care for people in Ireland. PHECC is governed by council whose members are appointed by the Minister for Health on the basis of their involvement and expertise in pre-hospital emergency care. Council is advised and assisted by standing committees made up of council members, health industry and community partners. The committees are the Education and Standards Committee, the Audit Committee, the Fitness to Practice Committee, the Medical Advisory Committee, the Appeals Panel and the Quality and Safety Committee. The Quality and Safety Committee is chaired by Shane Mooney. Shane has worked for the National Ambulance Service and its predecessors for 23 years. Now back working as an operational advanced paramedic and supervisor in Wicklow, Shane spends some time each year providing in-service training and staff upskilling as part of the National Ambulance Service training team in the Eastern region. Shane has been involved in numerous projects with PHECC as part of his role as a staff representative and has been involved with qualification assessment for the past few years. Shane outlines the role of the Quality and Safety Committee.
I think the role of the Quality and Safety Committee primarily is to consider and advise Council on a whole range of matters, primarily relating to operational aspects of clinical care. I think the main role that we would have over the coming term is to put in place guidelines that will support operationalising good best practice clinical care for the patients and service users that we deal with.
Here's how the Quality and Safety Committee is made up.
The Quality and Safety Committee is made up primarily of the industry, the people who provide pre-hospital care at any level. The main players, the statutory agencies like the National Ambulance Service and Dublin Fire Brigade, are joined by representatives from the voluntary organisations who provide care, the private ambulance service providers and the Defence Forces. There are another couple of individuals from patient focus groups and also a representative from the Irish Heart Foundation who bring all of their experience and expertise to the table.
Shane sets out what the Quality and Safety Committee hopes to achieve during its tenure of office.
I think the Quality and Safety Committee will have a particularly busy term this time round. There are a number of key objectives that we will be looking into, mainly focused around ensuring patient safety. We have a large amount of work to do in clinical audit and capturing the data to show what's actually happening out there on the front line. We have a large piece of work to do in continuing professional competency, or CPC, which we hope to roll out to the EMT level pretty quickly and then follow on with the paramedics and advanced paramedics. We want to relaunch or reinvigorate the Citizen CPR campaign, which has been a fantastic success. I think we can build on that. I think one of the key points that all of the PHECC committee and the council themselves are going to look at is the whole idea of licensing, credentialing of healthcare providers, both at an institutional level, at a service provider level and at an individual practitioner level. I think if we get through a lot of that work, we'll have had a successful term.
Finally, Shane tells us how the work of the Quality and Safety Committee affects how practitioners operate and in what way the work of the Quality and Safety Committee benefits the public.
I think the work of the Quality and Safety Committee, along with the work of the other committees and the PHECC Council as a whole, I think has an enormous effect on how care is provided to members of the public. The role of the Quality and Safety Committee will be to take those clinical practice guidelines and to put them and make them operational at all the different agencies to ensure that the care that's provided by any individual at any level is the very best that it can be for the patient that they deal with. As a practitioner working on the front line with the National Ambulance Service for some 20 odd years, I've seen firsthand the benefits of the work of the committees and the council over the last number of years. They absolutely do make a real difference to how I provide care to the patients I deal with on the ground every day.
For more information about the Quality and Safety Committee, log on to www.phecccit.ie.